Well, joining us now from New York, Dr. Tsion Firew, an emergency physician and assistant professor of emergency medicine at Columbia University. Madam, thank you so much for joining us here. There are quite shocking figures, in a sense, to see us two years now into the pandemic, to see the divergence between, I guess, Western, relatively wealthy nations, such a divergence. I mean, we've made the link with vaccines. Do you think that that's all there is behind this?
Well, as you stated, the U.S. is one of the rich countries, but unfortunately, before even the pandemic, it has one of the lowest scoring healthcare system. That definitely adds to it because there's so many inequities when it comes to access to care, and also when you're looking at the health score of the citizens, the U.S. has the worst, with especially a lot of comorbid conditions like diabetes, hypertension, COPD, and a lot of other chronic illnesses. So that puts people at a higher risk of having complications from COVID, but also, in addition to that, the unvaccinated rate also makes it grow the death rate exponentially. So it's multifactorial. But of course, now looking at the gap of the vaccination between the U.S. and Canada and Europe, the U.S. has one of the lowest vaccine rate among developed countries. And because of all the underlying conditions and the poor healthcare system, the numbers are worse, and they're probably going to be, in the next few months, even worse than we expected.
I mean, even countries that have a higher rate of vaccination, will have their core of people that are just hesitant about the vaccine. And I think every country will have a slightly different dynamic about the people who don't trust the system. When it comes to the U.S., is there a way we can look at where are the particular regions or the particular groups, the reasons why some people are hesitant about the vaccine?
Unfortunately, in this time and age, a lot of people who are considered influential come from social media. People that are political figures who use this anti-vaccination, or especially who are anti-vaccine mandates, are using it for political gain. And it is so, if you're seeing what's happening in the South, especially, a lot of the political leaders are using it to gain political support. So that, and also with social media influencers who do not have any healthcare background on Instagram and TikTok, have dominated these topics and are influencing especially young people. So this definitely adds to that, and unfortunately, this is going to be worse again over the summer, like we saw with the Delta variant last year. Over the summer, places like Florida and Texas are probably going to have it worse from Omicron.
I mean, it may be hard to know right now, but these statistics that show that obviously people that are unvaccinated are much more likely to either die or end up in hospital. Do you see that having an impact and maybe convincing more people to get vaccinated? I'm thinking, again, specifically of the U.S., comparing it to other vaguely similar European countries. In Europe, we tend to have a public health system, whereas, of course, in the U.S., it's much more expensive and private. Is all of that making a difference where, if someone is hesitant, maybe they might just get it because hospitalization would be very expensive?
Yeah, you would think with hospitalization being very expensive, it will take people to take the preventative action more seriously. But that hasn't been the case, because a lot of these influencers were using this political gain or for gaining, influencer access. I mean, being very influencer in this social media outlets, they're using it for the gain. And we'll see that some also media outlets like the Fox News, they're pushing this anti-vaccine mandate, especially in many places. And it's definitely gonna get worse in the next few months, especially for people who are unvaccinated. And the way I really don't know how we can actually convince more people, but I think one way is to really cancel all this anti-vaxxer noises that we're hearing about, and especially the social media influencers. And also, we see that mandates do work. Look at New York City and the state of New York. Indoor dining, and also when they made healthcare workers at several institutions, when they made it mandatory, the vaccination rates definitely went higher. But we've seen also now, especially the Supreme Court made the request and the push for making a mandate, they made it unconstitutional, except for healthcare workers. So when public health officials and healthcare workers are pushing for this and advocating for this, it just gets political and gets lost in this political action and political atmosphere. So we're pushing for, more of a public health approach, because at this point, preventative measures do actually work. They're cost effective. We're seeing the numbers from everywhere, also seeing it in New York and all over the U.S., how the unvaccinated are the ones who are overburdening the healthcare system. In addition to that, it's not like what it was two years ago when it initially started. People were scared, so they didn't come to the hospital for their strokes or heart attacks or for other things. And now we're seeing a lot of complications of other comorbidities like diabetes, hypertension. People that have not been taking care of themselves for the past 2 years are coming to the hospital either for COVID or for non-COVID things. So that is adding exponential burden to our healthcare system. And also, staff is burned out. There are a mass exodus of nurses leaving just healthcare in general, or going to other fields, or going to other hospitals that are less crowded. And also, when you add all the staff shortage because of also illnesses, it's putting a lot more burden on the healthcare system in general.
Absolutely.
And I really do hope at this point, using the data and what we're seeing in the hospital, hopefully can convince people. But I don't know what else we could say, especially people in healthcare work.
Yeah, and it's worth remembering as well that Omicron is not a particularly aggressive variant, very contagious, but not particularly aggressive. So it makes one wonder what would happen if a more aggressive variant came around. Tsion Firew, emergency physician and assistant professor of emergency medicine at Columbia University, speaking to us from New York. Madam, thank you.
Thank you.